They got the links out, so.
Hi, everybody. My name is Jordan. I'm one of the owners here at Pure Life Medical. Super excited. Thank you guys all so much for coming. I absolutely love listening to our medical director, Steve, chat and share with us about stem cells. It really is the future of modern medicine. So he's going to talk for about 30-45 minutes, then open it up to some Q&A. Following the Q&A, there will be an offer, for the people that are here. And those that are listening, if you type in your questions, Jeff and I will get them to you so we can get those answers as well. Okay, I'll turn the time over to Steve.
Thank you, Jordan. So I'm Steve Cox, PA. I'm the medical director here. I also have a clinic out in Hawaii, Stem Cell Institute of Hawaii, where I do stem cells, PRP, ozone, regenerative medicine. Overall, I've been doing regenerative medicine for about 10 years. Before that, I did orthopedic surgery for about 10 years. And so I've got a lot of experience, and I've done this talk quite a few times, and it's fun. So again, we're going to talk about regenerative stem cell therapy with an umbilical cord and placenta tissue. Now there are other places, and we'll talk about those. There are other places to get stem cells from. I just think this is probably the best place to get stem cells from. And I'll tell you why. So for those of you online, welcome. We'll go ahead and get started. Again, a little bit about me. I just kind of gave a brief summary, but I'm an independent physician assistant, here in Utah, certified by the NPPCA, NCCPA, and licensed in Utah, Hawaii, and Idaho. Again, I have my clinic out in Hawaii as well. Grew up in Southern California, which is why I don't like the cold. So this cold weather just gets me down. But I get to go out to Hawaii pretty often, and that's nice. I did my medical training at Eastern Virginia Medical School on the East Coast. In Southern Virginia, about 10 years experience in orthopedic surgery in Washington and here in Utah. And then switched over to regenerative medicine about 10 years ago, and functional medicine, focusing on healing the body rather than just doing surgery or prescribing pills. I've done various trainings all over the country for providers, businesses. I train clinics on how to do this stuff as well. And alternative medicine. I specialize in non-surgical orthopedics and ultrasound guided injections. And then I'm married, 4 kids. I enjoy camping, hiking, movies, video games, and going to Hawaii. I have the Y and the U up here because I did my undergrad at BYU, but I'm also a U fan. My son is at University of Utah, his freshman year. And then this is one of my favorite beaches on the Big Island on the Kona side, by the airport, White Sand Beach. Love it there. All right, so anybody know or familiar with this place?
Operating room.
Yeah. So I spent a lot of time in the operating room working on people, sewing people up, doing a lot of surgeries, and I try to keep people out of here if I can. So that's one of my main goals, is to keep people out of surgery. Sometimes it's necessary, and surgeries are great, they save lives, but sometimes it's not all the time is surgery necessary, kind of thing. And so it's one of the things that got me frustrated in orthopedics, was that I felt like a lot of orthopedic surgeons were just like, x-rays, surgery. X-ray surgery. It's like there's nothing in between. And I'm like, there might be some things in between. These are some x-rays. Some of you might, recognize some of these and what they are, and some of you might have them. This is a knee. Anybody know what this is? That's a hip. Shoulder. Very good. So when surgeons or when doctors say you have bone on bone, this is what they're talking about. So this is bone on bone right here. Osteoarthritis of the knee. You can see it's medial side because this is the fibula. Fibula is on the outside. And so this is pretty typical male osteoarthritis. It will affect the medial side, and you'll get bone on bone rubbing here, and that'll cause a lot of pain and swelling. And most of the time, a surgeon will look at this and be like, yeah, you probably need a knee replacement, depending on your age. And that kind of thing. This is hip osteoarthritis, bone on bone up here at the superior aspect, but pretty bad all the way around. You can see actually some reformation of the head. The head's supposed to be kind of circular, and this looks more kind of like oblong there. That's pretty bad. That would need a hip replacement usually. And then severe osteoarthritis of the shoulder. That's bone on bone as well. And these are the people who come in, and I'm like, lift your arm, and they're like this. And Again, typically would be a total shoulder replacement, but I have seen these respond, I've seen all of these respond very well to stem cells with improved function, improved motion, and a lot less pain and no surgery. So these are some of the big ones that I treat. Neck and back, also very, very common. Your neck is not supposed to look like this. It's not supposed to be straight. It's supposed to actually look like a C, like this. So we have loss of lordosis and actually a little bit of kyphosis here in the neck. So major malalignment, and that can be very, very painful. And sometimes they'll do surgery to go in there and fix that alignment and that kind of thing. This is the low back, lumbar spine. This is L5S1, which is L4-5 and L5S1 are the most common affected lumbar spine discs and vertebra. As far as slippage, as far as disc degeneration, you can see between L5S1 here, there's not a lot of space. It opens up a little bit here, there's not a lot of space here. That causes a lot of pain and can cause sciatica as well. And then L4 is actually slipped forward on L5 called spondylolisthesis, and that can be very painful as well. And so these do respond very well to non-surgical treatments with stem cells and injections and acupuncture and chiropractor and things like that. And so we don't always need to jump directly to surgery. This one you can't see very well, it's kind of whited out, but that's a very arthritic ankle. I treat ankles too, but they'll get people who can't really move their ankle anymore. And they'll say, oh, we just need to fuse it. And fusion of an ankle is, it's a thing, but it's not great. I've seen these respond very well. Actually, I had a guy out in Hawaii who he had almost no motion in his ankle. He was limping terribly. And I've been treating him for a couple of years now, with repeated treatment with stem cells, and he is so much better that his wife even mentioned me. He walks so much better and now he's getting to the point where he doesn't even notice, no limp anymore. What about autoimmune? What about other problems with the body besides just musculoskeletal? Musculoskeletal is kind of my thing, my jam, but there's a lot of issues going on with the body, especially autoimmune issues, rheumatoid arthritis, diabetes, thyroid, hypothyroidism, multiple sclerosis, celiac disease. These are all kind of manageable but not curable diseases in the body that can be very debilitating, and usually there's no surgery for them. And so then people ask me, well, what can we do can stem cells help the thyroid? Can they help rheumatoid arthritis? Can they help multiple sclerosis? Yes, they can. And we can put the stem cells IV, let them go throughout the whole body, and they go to areas of inflammation and damage and help to decrease that inflammation and start to repair and heal. So they can actually feel a lot better. It's not a cure, but it's definitely a more natural way to treat and help these people. So neuropathy. Anybody have neuropathy? No? Nobody here? Okay. Neuropathy is very, very common and becoming much, much more common for multiple reasons. Number one, autoimmune diseases are on the rise. Now, either we're getting better at finding them, or environmental conditions such as pesticides, things in the air, things like that are causing us to have a lot more autoimmunity. And so we're getting neuropathy, we're getting more diabetes and things like that. Now we have new peptides and drugs and things coming out that help with like diabetes and weight loss and things like that. But we're still seeing problems with neuropathy for sometimes no reason at all. Just people come in and say, yeah, my toes are numb. I don't know why. And we can't figure it out, but we know how the stem cells work, and we know that if we target the nerves and the damaged areas, we can increase blood flow to the area, increase oxygen. The stem cells can actually help heal some of the damage and create new neurons. The numbness gets better and neuropathy improves. So stem cells have been very, very good at helping neuropathy. In fact, I've got a patient now who's 83, type 2 diabetic, a little bit overweight, but came in originally with numbness from knees down, both legs, couldn't feel anything. And they actually came in because the wife was worried because he was falling a lot, couldn't feel his feet anymore, so he's falling all the time. And she's like, he's one fall away from being in the hospital with everything broken. So I started treating him with my neuropathy protocol, and now he's doing excellent. We're about, how far are we now? Three months, 6 months?
Yeah, about 5 months.
5 months, okay, 5 months out. It's a pretty intensive protocol for neuropathy, but he has full feeling back in both of his legs, and he's walking so much better. I don't worry about him at night right now. Soft tissue injuries. Soft tissue injuries actually respond very, very well to stem cells and to PRP. Steroid has been kind of a mainstay of treatment for these kind of things, but steroid just decreases, like a cortisone shot, decreases the inflammation, but doesn't really heal anything. And over time, if you get too many steroid shots, it'll actually atrophy the tissue, and it'll make it worse. But things like tennis elbow, Achilles tendonitis, even rotator cuff tendonitis, rotator cuff tears respond very, very well to stem cells and PRP. And it promotes healing, regeneration, and growth of new tissue. So works very, very well. And a lot of times we can avoid surgery on these. What about the brain? Memory issues, Alzheimer's, Parkinson's disease, even multiple sclerosis, which is a brain disease as well. Can stem cells help with these things? Yes, the answer is yes. Now, is it a cure? No. There is no cure currently for Alzheimer's disease or multiple sclerosis. Can we make it better? Yes, the studies have shown, and clinical data has shown that we could put stem cells up in the brain. Usually I like to do intranasal, which is a technique where we drip the stem cells intranasally back in the sphenopalatine fossa and let them absorb up into the brain. And we actually do see more activity and healing of damaged areas in Alzheimer's patients, Parkinson's patients, and even multiple sclerosis. And so it definitely helps with brain fog, memory issues. I mean, I've had patients say, I never used to do the bill at dinner when we got to dinner anymore because I couldn't remember, and I couldn't add up the numbers. And then all of a sudden now I can, great, perfect. I had one person say, yeah, my eyesight wasn't very good and I had macular degeneration and now my eyesight's better. And I'm like, excellent. And even one that I treated for macular degeneration, and he said, yeah, my macular degeneration didn't get better, but my hearing's better. So I'm like, okay, I'll take it. So we know we can treat the brain as well. And stem cells will basically go to any part of the body. They will start decrease inflammation and start to heal and repair damage that's been done. They also replicate and make new tissue, which is excellent because we all need more tissue, especially brain matter. So why do these things happen? Why is my body falling apart? And I think if we understand this key principle, then we can kind of start to see why stem cells work and why regenerative medicine is a good way to go if we're trying to make our body last longer. And as you guys probably know, it's degeneration, right? Our body breaks down over time. But why? Why does our body break down over time? And this is the answer. Is because we lose around 300 million cells per minute as we're sitting here. We're losing cells. Cells are breaking down, they're dying, we're creating new cells. The problem is that we create these new cells from stem cells, right? As we get older, we make less and less stem cells. So we cannot replenish the cells as fast as we're losing them. So as we age, they break down, they wear down. Adult stem cells age with the person too. And so yes, we're making stem cells in our organs, in our bone marrow, but they're not as vibrant as they used to be, nor are we making as many as we used to. And so things just break down. When we get hurt, we don't heal as fast. Bruises seem to last longer. Cuts seem to last longer before they scab and create new skin. The older we get, the more impaired our stem cells become, and we have less of them. Okay, and this has been studied extensively. This was from a study in 2017, but basically, our cells get older and are not as good as we get older. And so, well, let's talk a little bit about stem cells. There are different types of stem cells. We make them in our body, and there's not just one type, there are multiple types of stem cells. And so, the type that we're not supposed to use, that they tried to use to clone sheep and make organs and things like that, they're having some success with making small organs and replacing skin, like making ears and stuff. But these are the embryonic stem cells. See, these stem cells they get from embryos that are highly aggressive. They multiply like crazy, and they're actually meant to form something, right? Like a baby. These ones we are not allowed to use. FDA said these can only be used in research and maybe for like trying to cure cancer, and possibly making somebody a new ear. But other than that, we're not using them because they're so aggressive. What they found was that they're so aggressive, they would actually create tumors or teratomas. And that can lead to what's abnormal cells. Abnormal cells are cancer, right? And so we're trying to cure cancer. We're not trying to make people have cancer. So we don't use those. We don't use embryonic stem cells. There's also another type of stem cells called somatic or adult stem cells. Now, these are the stem cells that we make in our own body, like in our fat tissue or in our bone marrow, and they're the cells that replace all of the cells that we have in our body. Undifferentiated cells found living within specific differentiated tissues in our bodies. They can renew themselves and generate new cells. They just don't do it as good as it used to, kind of thing. That's why little babies and little toddlers are so bendy and nothing really bothers them. I mean, they'll fall off the couch. Have you ever seen a toddler? I had my toddler tumble down the stairs, and at the bottom, he gets up and he goes, "I'm okay," and wanders off and makes a mess. But if we did that, if we tumble down the stairs, we're not okay. We go break. I call the ambulance, and that's the reason why. So these adult stem cells are found throughout one's lifetime in tissue such as umbilical cord, placenta, bone marrow, muscle, brain, fat tissue, etc., etc. So we have a lot of these stem cells. It's just that we don't make a whole lot as we get older. So that's why, in my opinion, drilling into my bone here, taking my stem cells and giving them back to me is not as good of an option as taking the stem cells from the placenta or the umbilical cord. Right, because those are brand new stem cells that really are just alive and totally vibrant, and there's a ton of them. And we'll talk a little bit more about that. So we make different types of adult stem cells. So there's different types of stem cells, and there's different types of adult stem cells. So we have the hematopoietic stem cells, which is more like the blood cells, right? White blood cells, red blood cells, all of these things. There's mesenchymal stem cells, which mesenchymal is just a big medical word that means kind of tissue-related stem cells. Then there's neural stem cells, which are for the brain, epithelial stem cells for organ lining and skin. I mean, we replace skin cells all day long. In fact, they did a study that said most of the dust in the air is actually dead skin floating around. A little gruesome.
That would make sense.
When you think about it. But yeah, we're replacing cells all the time. So we have all these different adult stem cells. And what we want to focus on really is these mesenchymal tissue-related cells, because those they found to be very, very helpful because they can make or they can be reproduced into any kind of tissue, really, once you introduce them into the body. So what do the stem cells do? All right, we have a lot of them. Well, 5 vital functions. I used to say 4, but we added this one a couple of years back when studies showed that these type of stem cells, these mesenchymal stem cells, actually do signal to the rest of your body and other cells in your body to create this kind of cascade of healing and repair. But first and foremost, they can replicate, right? 1 becomes 2, 2 becomes 4, 4 becomes 8, so on and so forth, at least until they reach their limit. They differentiate and they specialize. We know that because we have different types of adult stem cells, and they've all been studied. And so a cell can replicate and then become a different type of cell that we need in our body. We know that stem cells can repair damaged areas. This has been studied extensively as well, that you can put stem cells in an area where damage and inflammation is, and the stem cells will actually decrease inflammation and start to heal and repair and create new tissue for that area. One that we didn't know about until probably about maybe 5 or 7 years ago, maybe up to 10 years ago, was homing. That these stem cells actually do home to areas in your body that are damaged and have inflammation, and they start to heal and repair them. And they kind of talk to the rest of your stem cells in your body using other cells called chemokines and cytokines and exosomes. and your body says, hey, this area is damaged over here, and the stem cells kind of migrate over there. And so they did a bunch of studies where they took these stem cells that were radioactively marked so they could follow them, and they injected them into people, and then they took serial imaging and saw where they went. And they said, yeah, they do. They congregated here, they congregated there, and they went here. And they corresponded with the disease processes that these people had. So pretty cool stuff. Let's see. Yep. Originally discovered in bone marrow. Okay, yeah, we know we make stem cells in our bone marrow, but have since been found throughout the entire body, which is they also are made in organs, bone, your fat stores some stem cells. And then they're also in breast milk, stem cells, menses blood, and then also can be found in placenta and umbilical cord. And we know that these stem cells can give rise to a large number of connective tissue types such as bone, cartilage, and fat, and that they can become these bone, cartilage, and fat, right? Maybe we don't want the fat so much, but the bone and the cartilage would be great. Found throughout the body and possibly even muscle. And so again, from the International Society of Stem Cell Research, which is constantly doing stem cell research. So we know what stem cells do, and we know what they can do, and we know that they can become tissue, and they can become cartilage and bone. So if we put them in a knee that has osteoarthritis, which means that they've lost cartilage and bone, will it create new cartilage and new bone? And the answer is yes. Unfortunately, sometimes it's not to the point where we can see it, right? And it's been my experience that the stem cells will kind of create almost like a pseudo cartilage, but not exactly like cartilage you had when you were 19, you know? And it's bone on bone, it's not really gonna take it and all of a sudden there's an all new cartilage back, you know? That's not kind of how it works, but it may create, we're talking about maybe 1 millimeter or 2 of stronger bone and maybe some pseudocartilage that actually helps the knee function better so that you can move and you can do your stuff and it doesn't hurt as much and we don't need surgery. So that's what we're focusing on here, because people tell me, oh, I want to see the x-rays, right? A year after I've done the stem cells, I want to see the x-rays and see it nice, you know, look perfect. I'm like, that doesn't happen. And if anybody says it does, it's not true. But if you got an MRI zoomed in, you'd probably see about 1 millimeter or 2 millimeters maybe of increased space, which is what we've seen on back MRIs, the MRIs, things like that. So mesenchymal stem cells also found low density in the blood. That makes sense, because how do the stem cells get to where they need to go? The bone marrow makes them, and then the blood, the vascular system takes them to where they need to go in the body. There's just not a whole lot. And so when you take blood out, yeah, you might have a couple stem cells in there, but not a whole lot, not really concentrated. They can be isolated from umbilical cord blood. Now, cord blood is a little bit different, right? Cord blood is actually from the mother to the baby, meant to help the baby grow. So this is chock full of stem cells, and the Wharton's jelly that surrounds the vasculature in the umbilical cord is also chock full of these mesenchymal stem cells, again, to feed the baby and help the baby grow. Amniotic fluid has stem cells in it, Wharton's jelly, we talked about that. And we talked about these MSCs, these mesenchymal stem cells are guided by chemokines and cytokines and other exosomes and signaling cells. They will actually home to specific areas. And more recent research showed, breast milk, menses blood, kidney, liver also have stem cells in those areas there. And it makes sense because our body is constantly breaking down and then building back up again. It's just, it doesn't build back up to what it was before. I wish it would. A little bit more about umbilical cord and placenta tissue matrix. You can't just go to the store and buy umbilical cord stem cells, right? That's not going to work. So it has to come from a lab, and it has to be a lab that's approved and monitored and inspected by the FDA, so that they know it's a safe product. And where does the umbilical cord and placenta tissue come from? From C-section deliveries. And so now we're getting better at it. At saving, this tissue and reusing it. We used to just throw it away. I mean, go at the hospital's incinerator, right? Called birth waste. I talked to a lady from Germany one time, and she's like, "Oh yeah, we've been doing this for hundreds of years." And we would keep the birth tissue, and then they dry it and chop it up into powder and put it in their tea and, that kind of thing. She's like, oh yeah, that's good stuff. And I was like, okay, yeah, we're starting to do it. And so now it's from scheduled C-section deliveries where the mother they have enough time, the lab has enough time to actually look at the history of the mother, the father, make sure there's nothing weird going on, no drugs, all safe. And then they get the tissue the day of the delivery, and they test it, they clean it, and then harvest the stem cells from it, and then cryo freeze it. And so it looks like it's a flowable, but it looks like that, kind of in a little tube. And then cryo frozen, these cells are pretty much preserved for forever. They have to put an expiration date on it per the FDA, but as long as they're kept negative 80 degrees, they're probably good for as long as you're alive. Kind of thing. And then you just take them out, you thaw them up, and they're ready to go. Okay, and the big question is, well, are cells lost in the cryopreservation procedure? And the answer is yes. Now you can put preservative, you can add preservative to stem cells to preserve them, and cryo-frozen, they will stay alive post-thaw, but yes, there is some that is lost. What we're looking for really post-thaw is that we have at least 8 million live stem cells, okay? And if there's less than that, then that's probably not industry standard kind of thing. Most of the labs that we use are between 10 and 15 million live stem cells per milliliter, okay? And they usually will, if they're on their ball, they should be giving you a letter of authenticity too that says how many cells are in it and what lot it was from and that kind of thing. We use a lab called RRG, Regenerative Research Group, and I've actually been using their product for about a decade, and it's a really, really good product. The nice thing about RRG is that all of their product is pre-COVID stem cells, which is nice. They were very, very aggressive in gathering product before COVID, and so they have a huge stock of cryopreserved pre-COVID stem cells, which is nice. Once they start harvesting again or gathering, mostly everybody at this point has been exposed to COVID. And it's what it is, I think. But still the stem cells will be potent and they will be good, okay? Here's their website if you guys want to take a look at it. Their main lab is here in Utah. Again, no harm to the baby, no harm to mom. It's just taken from C-section deliveries from the birth waste tissue. Shipped same day overnight, usually on dry ice. All right, that's a little bit more about RRG. You guys can take a look at that online. Methods of administration. So I get asked this a lot. Well, okay, so how do we get the stem cells from the little vial into you? And usually it's injection. Okay, I know it hurts sometimes, but not always. If you do an injection right, most of the time it doesn't hurt and it's very quick. But we got to get the stem cells into you somehow. And my philosophy on stem cells is that we're going to put it right where the damage is. And so there are some clinics that will just give everybody an IV of stem cells. And I'm not saying they're wrong, but the IV is going to go all over the body. We know they home to areas of inflammation and damage. And so I don't know if all of them are going to go to the knee, right? Because there may be an area like the liver or the kidney or the lungs or the heart that might also have some inflammation. And yes, it will help you that they'll go there. But if you come to me and you say, my knee is my problem, I want the stem cells in my knee, I'm going to put it in your knee. Okay, so it's going to be a direct injection into the knee, into the back, into the shoulder, into the ankle, wherever. So that's direct injection. I can't inject into the brain, nor would I recommend anybody do so. It's a little dangerous. So I use an intranasal technique with a sphenocath where I drip it in the back of the sinus there and let it allow it to absorb up into the brain. The studies have shown that it's up in the brain tissue within 20 minutes. And we see actually increased activity on PET scans. So that one, if anybody remembers the COVID test where they stuck it up there, wiggled it around a little bit, it kind of feels a little bit like that. Makes you cry, makes everybody cry. I've had it done, it made me cry. And then I have you lay kind of in Trendelenburg, which is, down like this a little bit for about 20 minutes, just to allow that stuff to absorb up in there. And it really does work very well. The other one is IV. I do put it IV. And there's some, I think for systemic diseases and autoimmune diseases, that's the best place to put it, is IV. Now, if somebody comes in with rheumatoid arthritis, which affects the hands a lot, it's very difficult and painful to inject every single joint of the hand. So I usually tell them, okay, which joints are the worst? I can inject those, and then let's put the rest IV, so that it's gonna go to kind of all the areas of the body. So I do that for diabetes, for multiple sclerosis, for rheumatoid arthritis, for thyroid disease. Also not very good to inject right into the thyroid. It's very vascular in this area, and we want to be very, very careful. But these are some things that I've treated over the years, even for aesthetics, skin. So I've done hair for hair, scalp, face for wrinkles with stem cells and PRP, works very well. And we don't have to worry about Botox. You know, because Botox essentially is like poison that we're just, you know, paralyzing the tissue, so there's no wrinkles. But what we find is that PRP and stem cells actually will encourage regeneration of some of the skin, not skin, sorry, some of the tissue underneath, so that the wrinkles actually are less. Shoulders, ankles, you know, anything musculoskeletal, of course. This is not an all-exhaustive list, but these are things that I have treated with stem cells and regenerative medicine with good results. A lot of the big ones are on the side that I added over there: neuropathy, diabetes, MS, anti-aging, wrinkles, brain, even erectile dysfunction. And so, you know, we have the sexual shots that typically have been with PRP, and PRP is great for that. Stem cells work even better for that. So, recent and current stem cell research. So there's always stem cell research going on, and you can get on Google and you can just Google stem cell research, and all of this stuff will come up. Current stem cell research. I mean, these are things that are going on right now. So they're doing a big study in Italy on MS, showing promise with stem cells from miscarried fetal donor. Now in the States here, we don't use miscarried stuff. If it's abortion or miscarriage, we don't use it. Only live C-section deliveries. But they don't have an FDA in other countries, so they can do what they want. But good success with MS. MS is a hugely debilitating neuro disease. Macular degeneration, this one's pretty big, especially as we get into our older years, Medicare years. Macular degeneration, we're losing sight in our eyes. Is there a way we can stop from going blind? Yeah, we're having improved sight with new retinal pigment epithelial cells with transplanted stem cells. So these same kind of cells and this kind of stem cells. Diabetic kidney disease, huge problem. This is what leads people most of the time to go on dialysis, right? It's end-stage renal disease or kidney failure due to diabetes. What we're finding is mesenchymal stem cells may delay the progression of kidney disease in diabetics. So the kidneys last longer. Prevention of graft versus host disease in transplant patients. That's pretty cool, because that's the huge thing you worry about with transplants, right? Is that my body's not going to accept it and it's going to reject it and it's just not going to work. They found when they added stem cells, there was actually a significant decrease in graft versus host disease in transplant patients, heart transplants, kidney transplants, lung transplants, that kind of thing. Yeah, and some other ones, you know, neurological patient disorders, we already knew that. It helps with neuropathy. Stroke patients, a lot of stroke patients get hemiplegia or hemiparesis or some kind of weakness or numbness after a stroke. They found when stem cells were added, the patients actually got better. So pretty cool stuff. This is all from 2023. So I have to look at all the studies from last year and now update this. So kind of wrapping up here, stem cells can help many medical issues, but it's not a cure. And really, you can't really even say stem cells treat a specific disease, right? Because they're not FDA approved like that. And so an FDA approved drug is usually FDA approved to treat a specific disease, right? And sometimes we use those drugs off label, like Ozempic. Ozempic was originally approved by the FDA to treat diabetes, not approved to treat weight loss or weight gain. So that one is used a lot now off label for weight loss. Okay, and that's okay. It's a good side effect. I like it. Stem cells are not that way. We can't say stem cells are approved by the FDA to treat or cure any specific disease. They are approved, however, to be used in this fashion to help. And the main caveat there is it has to be from a lab that is FDA approved and inspected, okay? So that's how we know they're safe. There's no guarantees, but there's no guarantees with anything. I mean, if the surgeon says, yeah, we're gonna go replace your shoulder, he can't guarantee you're gonna get all your motion back or that your pain's gonna ever go away, right? And so, that's, people want kind of a guarantee, and I'm like, there's no guarantees with anything. In medicine or in life, for that matter. Do you think insurance companies cover this? No, they typically do not cover natural remedies, or things that are holistic. Also, the insurance companies still consider them experimental. So, take it for what it's worth, stem cells have been around since like the 60s and 70s. So, and they've done studies for years and years and decades, and they're safe. Will they be covered by insurance at some point? I'm leaning more towards probably not, okay? It's just, they typically do not cover things that they can't control or they can't make money on. So, take that for what it's worth. Any questions? This is my question part. We already talked about that, how much does it cost? It's actually cheaper than it used to be, a lot cheaper than it used to be. There are still some clinics out there that'll really try to gouge you. And there was a couple clinics here in Utah that actually got shut down because they were charging people a lot of money, promising them results, and then actually fraudulently faking their results. So they got shut down, but it's pretty expensive. It's a little expensive, but affordable, better than it was. It just depends on how many stem cells kind of thing. And I usually do a whole program. Is there any chance of reaction or tumors? Nope. I haven't seen any. Not with these type of stem cells, they're safe. How long does it last? Years? Maybe decades? I mean, essentially, once you put those stem cells in there and they do their thing, that tissue is now your tissue. And it will last as long as it lasts. And so if you're nice to it, it'll last for a long time. If you go out and get injured, you're back at square one kind of thing. So I tell people, really take it easy. Is it effective? Is it safe? Yeah, and will it help me? It's kind of the big thing. And I say, will it help me? Because I had one guy come in and I did a consult with him and it was for a knee, and he came in and his leg was kind of like this. And so he's walking kind of like this. And his knee was obviously very valgus, very badly deformed from degenerative arthritis. He had lost a lot of bone. And so I talked to him and I said, hey, so what's your goal with this? Do we want less pain, a little bit more function, walk a little bit better? And he said, no, I want my knee to be straight. And I said, nope, you're in the wrong place for that, my friend. The stem cells will not do that. Now, the stem cells can help to heal some of the damage that's been done, but they're not going to fix that really bad anatomical, malalignment. So it's not for everybody. But I think it helps a lot of things, and most people, probably 9 out of 10 people, will be happy they had it done. Especially things straightforward like knees, backs, shoulders. These do really well. Neuropathy, kind of thing. So we try to think a little bit outside the box, outside of these. I didn't tell you guys my story. So I had stem cells in my knee about 6 years ago. I had a really bad meniscus tear back in my college days when I was at BYU. Had surgery with Dr. Kirk Kimball, who was the BYU orthopedic guy. And he went in and did a scope on my right knee, took out about probably 3/4 of my lateral meniscus. Okay, and the meniscus in the knee is the absorber, the cushion, right? Without the meniscus, you just kind of start grinding the cartilage away. So the studies have also shown that once you remove the meniscus, even a part of it, you're already set up for osteoarthritis. And I kind of felt that. Even I had the surgery, it was much better, but I had problems running, I had problems squatting, it just wasn't the same, it hurt. I definitely had problems hiking. So about 6 years ago, I put stem cells in my knee, and it has been great. I've been back to running, hiking, jogging, doing basically everything. The only time it really hurts is when I'm going like straight downhill. And that hurts a little bit, but I mention that because this is Kings Peak. Kings Peak's the highest peak in Utah. I did this with my son, that's my oldest right there, who's now at the University of Utah, but he's deathly afraid of heights, that's why he looks like that. It took him a long time to summit, And I was already at the summit, and I'm just kind of looking like, where's Cal? There he is. You know, I never would have been able to do that with my knee the way it was after the knee scope. But the stem cells got me back there, and this was probably about 3 years ago. All right, and then hiking to the waterfalls. This is a waterfall we hiked to in Yellowstone National Park. That one you don't have to hike to. That's why Willow Falls on Kauai. You can just drive to it. That's an easy one. But they really do help. And so if you have issues, you don't always have to do surgery. You can put stem cells in and you can feel better. So, any questions?
Yeah, so you mentioned that there's different types of these adult stem cells. So if you were looking to, like, you had a knee issue, and then you also had a brain-related issue, that sounds like you're dealing with 2 types of adult stem cells. So would you, for the brain, would you treat it, because I got a little confused because it sounds like something, but IV, and then it goes, but it sounds like you have specific types of stem cells too. So brain, would you treat that with these neural stem cell, and then with the knee is more of that tissue? So you're doing injection plus intranasal. How does that work?
That's a good question.
Kind of
Yeah, good question. And so the question is about different types of stem cells to treat different areas. Like if we're going to treat the brain, do we use specifically neural type stem cells? And the answer to that question is no, we don't, because those neural type stem cells are a derivative or a cycle kind of reproduction of these mesenchymal type stem cells. And so they're not, how do I put this? We cannot manipulate them in the lab to get these specific neural stem cells.
Oh, okay.
Per the FDA. These stem cells have to be minimally manipulated by the lab, which means that they can be harvested, but the only thing they can add to them is a preservative or saline, and that's it. We're not allowed to grow them, we're not allowed to expand them, we're not allowed to replicate them to try to get these specific cells, right? So what we have access to is kind of these origin stem cells that are mesenchymal type stem cells, that are tissue related stem cells. Now they can become these neural type stem cells in the body once we put them in there. And so,
But the body's gonna.
but the body is going to tell them what to become, kind of thing.
So if you're treating multiple areas, you're gonna use that same type of cell that we're harvesting
Correct.
and then inject it for the body, or however you might do it. Combo of the injection site and then, like you said, I can't remember how you, IV.
Correct. So what we have access to is these mesenchymal stem cells, and we know that they become different types of cells, and they have the capability to become these different types of cells, like neural stem cells or muscle cells or things like that. But that doesn't happen until we put them in the body, and the body tells them what to do. That kind of thing. So, good question. Anything else?
So you showed those little vials that
Mhm.
they come in. So does one vial have to be used for like someone with a knee problem, and a whole vial goes into the knee?
Not necessarily, but usually yes. And so like a large joint, like a shoulder, hip, or knee, I will typically use 1 milliliter or 1 cc of stem cells for that area. For areas of the back, I may need more. I may need, 2 or 3 vials, just depending on how many levels of the back is affected. For the brain, for intranasal, I usually use 1 cc. For IV, typically I will use 2 or 3 cc's of stem cells just to really flood the body. Kind of thing. And put them in there. And they're very safe. There hasn't been any reactions, allergic or anaphylaxis or anything like that. If you do an IV on anybody, no matter what you're infusing, whether you're just putting fluid, vitamins, antibiotics, there's always a chance for a flu-like symptoms with an IV. Okay, you can get a low-grade fever, you can kind of feel not so good, nauseous, that kind of thing. But that's pretty typical.
So the previous slide you said, how much does it cost? And then here you say it depends on conditions where probably it's a factor of the number of vials you use and then how you're injecting it into the.
It is, yes. And so I create a program kind of based on you and what's going on and what I think will be the best. And not all programs are the same. And some programs are a little bit more expensive than others, but typically we try to keep the cost down and make it affordable. Okay? And I can't tell you because I don't know how much, you know.
You put it up there, you're the one who put the question on it.
Yep, I put it up there. All right, any other questions? Any questions online?
We actually did have a question from
Yeah.
online. So somebody was wondering if you draw some stem cells from the bone marrow and spin that down, on average, how many stem cells would you get from something like that?
Don't know.
Depends on the
Yeah,
person.
it's really, really varied. Because it depends on how old is the person, what area did you take the stem cells from, how much of the bone marrow did you get, what kind of centrifuge did you use, how long did you spin it, how much did you draw up as a flowable? I mean, there's so many variables with an in-office procedure that it's almost impossible to tell how many stem cells you're gonna get. And that's again, one of the reasons why I don't recommend drawing it from yourself in an in-office procedure. Number one, they have to drill into the bone and that hurts, okay? And sometimes that hurts more than your actual problem. Number two, you don't know how many stem cells you're getting, or even if they're good stem cells. You have no idea. And so I just don't recommend it.
So it's either unknown or 10 million stem cells in each gem.
It's definitely not gonna be 10 million, I'll tell you that.
Well, 10 million from these stem cells.
Oh, yeah, sorry.
Correct.
Yes, when we get the umbilical cord, we get a paper from them that says, this has all been tested, it doesn't have these diseases, and this is how many live stem cells we have seen in this lot. Okay, and that's what we can expect. And so that I know exactly what it's gonna do and how many stem cells there are, and I know it's gonna work. Good
So I
question.
don't want to simplify it, but is the risk really in the cost? And that it might not work, because you said that as far as that. Introducing other problems to organs or a negative reaction from the body. Doesn't sound like that's creating tumors, you know, because it's spurring growth, right?
Right.
So I just
Right.
want to make sure I understand the risk.
So the risk involved is really purely that there's no guarantees,
Yeah.
it may not work as well as we hope. But in my experience, it still helps.
Yeah.
It still helps people. It just may not help exactly the way I hoped it would, or as much as I hoped it would. There's no risk of allergic reaction, there's no risk of making you worse, and there's no risk of tumors or cancer.
Yeah.
Okay.
How do you, I guess you mentioned that it was like, kind of like a case by case scenario of like. What would work more for one patient than it would work for another. My sister made a pretty good comment here, so, how would, I guess, would you just go off of like word of mouth to be like, oh, hey, I have a problem with my knee.
Mhm.
I wanna work on that, but. Is that all, again, I don't know if I'm verbalizing
No,
this
it's fine.
correctly.
I think I get what you're trying to say.
Yeah, like,
I'm an orthopedic guy.
Yeah.
Right? I did orthopedics for forever.
mhm.
What do orthopedics always wanna see? Imaging, right?
Yeah.
X-rays. We always wanna see the X-rays, we always wanna see the MRI because we wanna see exactly what's going on in the knee. I have to have something.
Mhm.
Now, there has been cases where patients will come in and they don't have access to X-ray, MRI.
Mhm.
I have an ultrasound machine that I use to do my injections with. I can see pretty good with that, and it gives me a good idea of what's going on in the knee. But if I can get images, X-rays, MRI, CT scans, I love it. Because I'm like, yeah, here's what's going on.
So then you would base the, I guess, or like just the plan on that.
Yep.
Instead of just like word of mouth, just like, oh yeah, like I'm really hurting here, or can this help with my vision, you know, like.
Yeah, I
So-
mean, I can only go by what you tell me.
Mhm.
If I don't have anything concrete to look at.
Yeah,
I just trust you, right? And
Right.
you tell me this is what's going on, so that's what I'm going to assume, this is what's going on.
Mhm.
And so even if I don't have the imaging available, which if you did have an imaging or an MRI or something, that'd be great. If you didn't, I could still probably make a plan or a program based on what you tell me. And then based on my physical examination as well, as I examine you and that kind of thing. And so
Are there specific tests that you do if like we don't have access to any like imaging or anything like that, besides the ultrasound?
I mean, it depends on what the problem is, and so if somebody comes in and says, yeah, I've got arthritis in my shoulder.
Mhm.
I'll move the shoulder around and kind of see what it feels like and do my
Yeah.
tests, that kind of thing.
Mhm.
I can look at it with the ultrasound and get a pretty good idea of what's, what's going on. So then based on what you tell me, my physical examination and any imaging that I can do,
Mhm.
I can make a good plan.
Is that all, like, is there like a specific like price range to like get started on that, or is it just, I guess?
It's just a consult, and so
Uh-huh.
you do a consult with me and I go over your kind of history and physical and, move things around and do my examinations and things like that.
I guess, is there a price for the
And so
consult?
then, yeah,
or
the consult
just
price is
$97.
$97.
$97? Thank you.
Yeah, you're welcome. Great question.
Kind of
Crazy.
And that would, and by the end of that consult, I would be able to have a plan and a program for you to say, this is what's going on, and this is what I think will help.
Okay,
And if I can't help it, I'll point you in the right direction.
perfect.
So. Very good. Any other questions?